All right. So thank you. I kind of slid myself into conference today. I'll be giving a lecture on tips on how to give a good lecture. This is part two. Essentially, this is a second part of a lecture that Dr. Willis actually gave as his senior lecture, and last gave it kind of a few years ago. It is on our county EM YouTube page. It's chock full of like really, really good information. So I would recommend that people actually go and watch this after this. Mostly just to get a lot of tips, and I'm not going to really go over a lot of the things that he covered. All right, so the premise of this is that I'm going to review one of my old presentations from PGY 1 year. I'm going to critique it, show kind of where I did good, where I could have improved, so that along the way we can hopefully try to avoid some common pitfalls. And the reason in particular I'm doing this lecture is because I picked this out as something I really wanted to get better at, especially this year. So I'm excited to share some of these tips with you guys. So tip number one, show your enthusiasm. The same way that James talks about echo, the same way that Vince talks about epic. Showing your enthusiasm early can help you really capture the attention of the audience from the start, especially during the honeymoon period. And the honeymoon period is the kind of general idea that you have around 2 minutes at the beginning of your presentation to really make an impression on the audience. And they'll decide whether they really want to engage with what you're saying or if they're just going to be distracted the whole time and not really pay attention. All right. So let's jump right in. Here's my clinical pearls lecture from intern year. Uh, we'll move on. Table of contents here. Not very exciting. We have a large block of text here and an additional history, lots of bullet points, as you can see. So let's address the first issue here. Get rid of bullet points. All right. Mostly because it's way too overused at this point to the point of being boring. There are ways to really get around this, and we're going to discuss how to do this. So use images. So a lot of times you can replace the bullet points that you're saying with images that represent the sentiment that you're trying to get across. All right. And this is taking advantage of something called the image superiority effect. And so this is the idea that using images plus words, as opposed to just words and you speaking them, helps the audience recall significantly more of what you were saying. And that's the whole point of these presentations, is that you want people to remember what you are saying. All right, so instead of this, we could easily turn it into this, nothing crazy, but we get rid of the bullet points, it gets across the same sentiment. All right, and so we'll move on to the next point. Use more slides. So if you get to the point where you are putting a lot of pictures on one slide, or you have large chunks of text that the audience is clearly trying to understand as you are talking, this is an opportunity for you to really just break it up into many different slides. Make more chunks instead of putting everything in one area. And this is trying to take advantage of the 3-second rule, which is the idea that in 3 seconds or less, the audience should be able to understand what you're trying to get across. All right. If the audience is spending more than 3 seconds reading what you have on the slide or trying to understand all the pictures that you have, then they won't be listening to you speaking for like the first 5-10 seconds of what you're saying, and they'll miss out on really important things. All right. So instead of this large block of text where I would read off of this and the audience would read off of this, we could split it up. We could start with a picture, chief complaint, alcohol intoxication. All right. We go and talk to the patient. They endorsed drinking earlier today. They say their last drink was around 6 hours ago, but otherwise kind of refuse to answer questions. But you need to ask more questions. So what questions would you ask? Essentially, I'm getting across the same information as that big chunk of text, but I'm doing it, using pictures to kind of guide us through it, as opposed to you reading it, me reading it, just a little bit more boring. All right, and so for the final tip to help out with decreasing bullet points, sequentially list out what you want to say when you want the audience to focus on something. So another way to address the 3-second rule. So this avoids the audience kind of reading ahead of you by having them only focus on what you were talking about at that moment. All right, so instead of this page, we can start like this, withdrawal seizures, and then you can extrapolate on what you want to say about it. Move on to drug use, move on to mental health. Why did they stop? So one at a time, you're making the audience kind of sit with you at each point. And then you can use pictures as well. So this gives more time to keep the audience's attention for you to really explain your points without people trying to just jump ahead. All right. So to recap, tip number one, get rid of bullet points, use more images. use more slides, and sequentially list out items. All right, so moving on. Here I have a physical exam slide with bullet points, mild withdrawal symptoms, hallucinating another case, more symptoms, another case, more symptoms, a case of what sounds like a pretty sick patient, more symptoms. Yeah, so not particularly inspiring, pretty boring, even kind of me looking back at my own presentations. So the next tip here is elicit emotions. So the issue with a story sometimes is that the audience can get pretty distant to what you're presenting if you don't really give them a reason to engage. So a solution here is to draw their attention in and make them feel like they're part of the story. And we're going to talk about ways of doing that, talk about ways of eliciting emotions. So instead of this, where I just list off a physical exam, like I am at least kind of highlighting words that are important. Still, you can feel really distant if you're just reading off of this. Instead, you can say, patients coming in, they're diaphoretic. They have tongue fasciculations. They have hand tremors. And the whole point here is you want to be as concrete as you can. More concrete as opposed to ambiguous kind of intangible descriptions gives the audience an opportunity to really kind of put themselves in your shoes. And kind of concrete visual details lend credibility to what you are saying and what you're presenting. All right, and next step, tell a story. Use stories that the audiences can imagine themselves actually being in. Because stories are a way for the audience to kind of mentally simulate the situation that you're asking them to do. So if you want people to change their behaviors towards like prescribing medical assisted therapy, ask them to visualize themselves in a story where that's an option, where they actually do make that decision. All right. And when you're using these stories, engage the senses. Describe the sounds that you're seeing. Show visuals. Use sense even when it's appropriate, because you want to make the audience feel like they're actually part of the story. So a better way of this slide is to turn it into a story. Say, picture yourself on a CCT shift. It's a regular shift when all of a sudden you hear someone shouting from the triage room. A lot of curse words. You hear the sound of like the bed hitting the wall. You know that this is going to be a problem. You're going to have to go over there and address this. And you see a person thrashing around. They're throwing punches. They're saying curse words. They're diaphoretic. You know that they are a danger to the staff and everyone around you. So you gather all your team, you get the person down, you 5 and 4 them. You're like, great, all right. Hopefully vitals are fine. I'm gonna clear to the pod after watching for a little bit. But you realize they're febrile, they're tachycardic to like 130s, 150s. And they're clearly disoriented and even hallucinating from what you were hearing. All right, and so now you're left wondering, like, okay, this is kind of a sick patient. I can't just kind of write them off. They're febrile, tachycardic, they're altered. Do I need to CT head them? Do I need to LP this person? Because this is going to be the worst LP of my life I can anticipate, given how agitated the person is. Should I just empirically give antibiotics right now? And then you sit down and realize that their chief complaint was alcohol intoxication. And you note that someone was saying that their last drink was many hours ago. And so now you are realizing that this is a dangerous situation because this person might actually be having delirium tremens. So again, you get the same idea across, but you're at least trying to get people buy-in by having them put themselves in the scenario that you were in. You're trying to elicit the emotions, trying to describe the scene as concrete as possible. All right, so to recap, tip number 2, be concrete, tell a story, and engage the senses to really try to drive engagement with the audience. All right, and so as we move on, here we see I'm talking about treatment strategies. I have a table. I have another table. I have sub-bullet points, pictures. I went really ham right here on just like putting out so much text. And I dabbled with some humor here. So on to our last tip, make it easier for the audience to engage. You want to make it easier for the audience to kind of understand the message that you're trying to get across. And some of the ways that we're going to do this, simplify where you can. All right. So instead of this slide where, it's not terrible, it's not the most exciting thing. The placement is a little weird, it's a little bit low on the page. The most common meds probably isn't even necessary at this point. You can make it this, blow it up, make the text as big as possible. I'm not asking people to make like beautiful, aesthetically pleasing figures because this one isn't that. But what I am asking is that you make the text easier to see. You make the points you're trying to make easier to understand. If you have a table from a study, we really don't need all of the information on that forest graph often, most of the time. We really only need certain pieces of information that you are trying to tell us about. So really highlight those important parts, make it easier for the audience to really hone in on what you want them to focus on. Next tip is contrast what is with what could be. And this is not just highlighting specific text that you want people to understand, but also a way to give a persuasive argument. So the idea is that if you show the audience what the standard of care is first, and then show them what it could be, or what the treatment strategy is, or the way of thinking that you want them to have, that contrast drives engagement. So for instance, instead of this wordy slide, you could be like, all right, so patients with alcohol withdrawal, oftentimes the treatment is some benzos, Valium, for instance. If that doesn't work, you just double the benzo, all right? If the patient is still having a lot of symptoms, maybe you want to consider doubling the benzo, all right? After that, if that's not really working, you maybe should think about some other things like doubling the benzo. At this point, if it's really not working, you should consider doubling the benzo one more time. And then at this point, now you want to just propofol and intubate the patient. Whereas there has been recent studies, not the greatest literature, but more coming out describing the use of phenobarbital instead of benzodiazepines at a dose of 130 to 260 or 10 mg per kg that decreases ICU admissions, decreases hospital length of stay, and decreases the amount of benzodiazepine use. Again, the idea is to contrast what is currently happening with what could be happening, because the more contrast you have, the more engagement you get from the audience. Because now they have a little bit of cognitive dissonance. They're like, I don't do this. Maybe I should consider doing this. And extra points if you can make an emotional appeal as well. And lastly, use interactive applications. So I saw Julian did this earlier. I was really excited about that because asking for audience participation can be hard, especially over Zoom. It is an effective way of getting people engaged, but we've all been there where we ask a question on Zoom and we hear this, just a bunch of crickets. We're waiting on someone to answer. It's usually Shane. You can call on someone to answer this, and there's a time and place for all of this, but there is a friction there that we can maybe work around. And so here I'm going to give an example as well. So this slide could use some work. How would you improve this slide? And for this, I am going to have us I want people to take a picture of this QR code, answer how you would improve this slide based on some of the tips I was talking about here. Great. Use images, more pictures, less text. Love it. There's also the idea that, you can hold the audience's attention for like 10 minutes at a time, even with the most engaging person. But after a while, people need a break. And it's usually around the 10-minute part. So consider, as if you have a really long presentation, also breaking up your presentation into like 10-minute blocks and give people opportunities to do things like this, where you're answering anonymously. You're not really putting that much information in, that much thought process into this, because you're giving people a bit of a break. So great. No bullet points, less bullet points, arrows instead of bullets. Love this. Highlight what you want to say sequentially. Great, exactly. So, and so for the last part, we're going to recap, make it easier to engage, simplify where you can, use contrast, what is versus what could be, and use interactive applications. All right, so here's my summary slide from PGY1 year. I like using the DJ Khaled major keys. So for my summary here, get rid of bullet points. Use more pictures, use more slides, sequentially list out your items, elicit emotions, be concrete with your descriptions, tell a story, and really try to engage the audience in what you're trying to say. And then lastly, make it easier for the audience to engage with you. Simplify where you can, contrast what is with what could be, and consider using easier sources of information, of engagement. All right, I think by using some of these tips, we can all kind of make our presentation just a little bit better. All right, and here are the sources I used for this.